Hello and welcome to Positive Parenting. I'm Deanne Conrad, Community Relations Supervisor for the Sioux Falls School District. Positive Parenting is a joint venture between the medical professionals of Sanford Health and the education professionals of the Sioux Falls School District. We thank you for joining us today our topic today, we're talking about flu and influenza versus stomach flu, prevention that can be done in order to take care of spreading the illness and such. So that conversation seems like we have it every time this time of year, but it is a good reminder for all of us. If it's out of sight, out of mind, maybe we haven't been thinking about it as closely as we should be the last several months. And now the season of flu is upon us, and we need to remind ourselves about some of those techniques that can help prevent the spread of the illness. We have wonderful guests joining us today that have a wealth of knowledge about the topic. I'll have each of them introduce themselves to get started.
Hi, I'm Dr. Carrie Orstad, and I'm a family medicine physician. I work at the Sanford Family Medicine Clinic at 69th and Louise.
Thanks for joining us.
And I'm Molly Saturn. I'm the Health Services Supervisor with the Sioux Falls School District.
So we will center our conversation around something no one really likes to talk about, or no one really likes to experience the flu. For sure, it's not something that anyone looks forward to, but it seems like this time of year is the way. It's just something we have to deal with. So there always seems to be a little confusion about flu, the stomach flu versus influenza. And influenza is really that respiratory kind of illness.
It is.
And stomach flu is more of the digestive system.
Right. Yeah, the stomach flu is caused by a variety of bacteria and viruses, and it is primarily digestive, so nausea, vomiting, diarrhea, that sort of thing, and can last an assortment of days, number of days, depending on what the cause is. But specifically today we're talking about influenza.
Right.
And so they are a strain of viruses, and you've probably heard of influenza A and influenza B.
Yes.
There are different types out there, but the most important part is that yes, it is primarily a respiratory illness. Okay. And so the more common symptoms that you'll see would be a cough, a little shortness of breath, fever is very common. Headaches and body aches can certainly be a big part of it, and fatigue. And sometimes you do get a little upset stomach. You'll have some nausea, you can have diarrhea and vomiting, but those would not be the primary symptoms.
Sure.
Mostly the fever and the cough.
Sure. And those illnesses seem to multiply quickly.
Yes, they do.
In a family, whether you're, the illness is running through the family, or at work, or in schools. Because of the close proximity, that's kind of one of the things that you're probably paying a lot of attention to right now.
Yep, absolutely. Anytime persons are in a closed, confined space together, there's more likelihood for viruses and bacteria to spread. And so with influenza, it can be spread through them coughing and through the droplets in the air, and then also can be spread through them touching different surfaces. And as we know, kids are all over the place, and they love to hug on their friends, and they, which is wonderful, but when it comes to flu season, that can be problematic, and that can be where you see the spread of the illness.
Yeah. And that's why, probably as we get into the colder winter months, we always think, okay, get the kids outside to go run and play, but there are particular times when the kids can't even get outside if it's too cold. We don't have recess, and so they're in a classroom all day long with their 25 friends. Exactly. And that spread is pretty easy, even with prevention methods that we've been teaching.
Right. We do many things to prevent the spread of illness. Of course, we can't prevent all of that, but we do education with students, with teachers. We have hospital-grade cleaners available, hand sanitizer, teaching kids how to wash their hands properly. So a variety of things that we do to help prevent that spread in the school setting.
This all seems very common sense kind of things that we tell people to do. Cough into your elbow, use a tissue, and then throw it away. Those types of things seem very common sense, and it seems like in this day of technology, it should be easier to just, spray something in the air and make it all go away, but that's never going to be the case with illnesses like this.
Probably not. Well, maybe someday, but not anytime real soon.
Yeah.
So, yeah, the biggest thing right now is just to prevent the spread as much as you can, and every person needs to be cautious about washing their hands and making sure they are staying safe, not sharing a drink with a friend and that sort of thing, because those pop bottles can definitely carry that to someone else.
Right.
So,
Or water bottles that at our house, it seems like the water bottles multiply constantly, and it's like, then somebody grabs one as they're heading out the door to practice, and maybe it wasn't washed from the last time, or what have you. And so those things, we really need to take basic precautions on those and make that a priority, really. And in terms of those prevention efforts that can really be effective in reducing the spread of illness, basic hand washing is like top notch, right?
It is, and it's tempting to just quick wash your hands and be done, but to really do a good job, you have to be there for a while. And so the majority of the bacteria and viruses and other materials are going to get flushed off your hands with the time under the water. And so soap, of course, is important. That kind of helps to mobilize those things, but it doesn't really matter which soap you use as long as you're using it consistently. And so you need to be there for that 15 to 20 seconds, and you need to take the time to make sure your hands are completely clean.
Slowing a child down for 15 to 20 seconds to wash their hands is a challenge.
It is.
Sometimes
It's hard
it's a
for us,
challenge
too.
for adults. I was just going to say, seems like an awful long time when you're standing there. But what are some of the techniques that our nurses are using in the schools to help them, help the students understand the length of time, and even, not just while letting the water. I always tell my son too, yes, I know you've got your hands under the water, but you need a little action to go along with that. But
so our nurses can and do go into classrooms and provide training on hand washing. We have some germ fighting kits that they can take in. They talk to them about using songs, the ABC song, the Happy Birthday song, to give them a tool to measure how long that they're washing and rinsing. So using those types of things to just teach kids the importance of that basic hand washing and how to do it properly.
Right. And I'm noticing, and maybe I just wasn't paying attention in the past, but in restaurants and other public facilities, a lot more signage as serving as reminders. If it's information from the Center for Disease Control, or just their own sort of sign that reminds people to wash hands and things like that. So are we doing a better job with awareness, do you think?
I think so. I think the word is out. When I think of most public restrooms I've been in, there's almost always a sign in there reminding people of that hand washing. So I would say that in general the public is more aware, and that there is more notification out there. So that's a great thing.
Sure. In that realm, while we're educating the students in the classroom, I know sometimes the kids are educating me, reminding me, and that's a great tool for change as well. Sometimes those kids can be really,
Persistent?
Yeah, persistent and change agents, for us. So as adults, we really need to model the best way for prevention also.
We do. And you will always see those signs year round, but you will notice, I agree, that they come out around flu season, because that's when we're all confined together and sharing our illnesses. So
the way that the flu sort of, there's a peak time, traditionally peak time, but talk a little bit about that, when the flu season typically peaks around here, and sort of how you're preparing for that, or how do we know when it's coming this direction?
Well, the CDC actually is a good resource, because they do track all of that data, and the flu does come through mostly in the wintertime around our area, and it varies, but our flu season traditionally in South Dakota has been closer to February. The last couple of years it's changed a little bit. We've gotten a little earlier, and last year was even early to mid-December we were seeing quite a bit. Not as much this year. I think we certainly haven't hit our peak yet, but there have been some cases in the area of influenza, so it's certainly out there.
Right. And then are we, as you said, it sort of moves through the United States. You can kind of tell when it's going to end up on our doorstep.
We can, and like I said, it varies from year to year, and it depends on the strains that are going through too. And so the CDC and other resources certainly track that, and it usually hits the southern states before it hits us, kind of moves forward and up into the Midwest a little bit later in the season usually. And so a lot of states have already had their kind of peak flu season, or at least are getting right into it right now.
How are the schools tracking that sort of illness, and is it necessary for us? Is it important information for us to have? Or you know, we seems like after the holidays you tend to maybe pay more attention to those attendance records and absenteeism and that kind of thing.
Sure. Well, we do work closely with the State Department of Health, and so they are a great resource for us in kind of giving us the heads up when we are going to see more of an epidemic type of thing. And so we kind of get some information from them, as well as tracking our own attendance in the Sioux Falls School District. And currently our attendance is good and below where we've been in the past as far as absences. And so I would say this so far has been a more mild year, but certainly we watch those trends and compare those to previous years and that kind of thing. So.
And illness such as the flu in young children can be very serious. It can be just, you know, inconvenience on one level, but it also can be a very serious illness for children.
It can. And I think children, young children especially, are the ones that are at the highest risk, but even adults can be at risk for that, even healthy people. And so I think that the biggest thing is just to keep close tabs on that kid and watch them very closely, because the typical influenza course is unfortunately going to be a good week or more, and usually you're very fatigued, maybe even a little lethargic. You've got that fever, you cough, you just have no energy. But little kids don't have as much of a reserve, and so when they get sick, they often get sick very fast. And so every year there are certainly hospitalizations for influenza and some deaths too. So,
and I think you know, another population that is particularly susceptible is a child that's already has some compromise to their immune system.
Right.
You know, not another illness, but a lifelong condition that really challenges them, whether that be asthma or breathing or you know, internal issues of another nature.
Right. And there are kids that appear healthy. So your kids' friends may look healthy, but they may be taking medications that suppress their immune system. They may have a condition where they can't get the flu shot, so they can't protect themselves. They may have, like you said, asthma or other conditions like that. And so those ones, while certainly, you know, anybody can end up in the hospital with influenza if they get a bad enough case, but those are certainly the ones that are going to be more at risk.
Sure. And certainly we're encouraging people to get flu shots. It always seems like that reminder starts coming out October, that kind of thing. I know my own health clinic, where Dr. Orstad works, had some flu shot clinics and available time in October and November, which we did take advantage of, I will say. But the schools in the past have been able to offer flu vaccinations as a matter of convenience at our middle and high schools. That was wonderful. However, things are changing.
Correct.
Okay.
For the last several years, including this last year, we were able to provide flu vaccine free of charge to middle and high school students. And we were notified recently that the Department of Health will no longer be providing the free vaccine starting next year. So next school year, we will not be able to provide that vaccine. So we want to start encouraging parents and letting parents know ahead of time that that's the case, and that we would encourage them to go to their healthcare provider and their clinics to get that flu shot.
Right.
So we certainly want to still encourage that. It's very important to get your flu shot. We just will not be able to provide it there in the school setting.
Right, and we know the convenience factor. As a busy mom, as a parent, you just, oh my gosh, I have to make an appointment, or you need to get them there at a particular time when the clinics are, and that was a matter of convenience that we were able to do that. And as a school district, we're certainly, you know, we're happy to do that. However, just some changes within the state and within the system in general will prevent us from doing that in the future. So plan ahead, know that next year your middle and high school student, maybe they did get it at school this past year or in years past, but that will be something that parents will be responsible for in the future. The criticality of getting the flu shot, does it matter? How long does the flu shot guarantee prevention? And guarantee is a very loose word. I use that as it never guarantees, but what length of time is that effective?
You know, the nice thing about the flu shots are that, as far as we know, the length of time it protects you is actually fairly long. It's at least 6 months, and we believe it's actually about a year. And so if you get your flu shot, say your clinic gets it early, they have it at late September, and you get your shot then, you are still protected through March and beyond. And so there really isn't a problem, as far as we know, of getting the shot too early.
Sure.
There is a problem with getting it too late. Obviously, if the flu has already come into the area, you still have the chance to get the flu shot. There are still flu shots available at some of the clinics, and so if you haven't gotten it yet, you should go get it.
Call now.
Yes, call now. But the biggest thing is that it takes about 2 weeks from the time you get the shot to when your immune system is revved up and ready to fight off the flu. And so if you get your flu shot and you're exposed to someone in your classroom or wherever with the flu a couple days later, that flu shot is not going to do you any good.
We always hear topics, conversation, seems like I always hear this every year. Well, I'm not going to get the flu shot because I've heard that gives you the flu.
It does not.
So, thank you.
But I hear that a lot
not.
too. Yes,
yes,
I hear that
yes.
a lot.
Where are people getting
Well,
that from?
you know, any vaccine can have side effects, and common side effects of the flu shot would be the most common things are injection site reaction.
Sure.
So redness, little tenderness, sometimes your arm aches. It's but you can also have some fatigue, even a low grade fever, and just kind of feel under the weather for a couple of days after you've had a vaccine. And so what that is that's your immune system focusing on this little invader here and trying to make the antibodies it needs for it. Now the good news is the flu shot does not have a live virus. So it has either a killed virus, that is, it's the whole thing, but it's not going to multiply, or it has particles that are on the surface of the virus. And so there are certainly live virus vaccines, and those are usually either an inactivated version or basically really decreases its chance of multiplying. If it does multiply, it does just a little bit, so it's not going to cause a full-blown infection. Like we said earlier, there are certainly some people that cannot get those live virus vaccines, but the majority of the flu shots that are available are all killed virus. So you can't get the flu. It's not possible to get the flu from influenza, but you can certainly have side effects.
Okay.
Or you could have your shot and then be exposed to someone 3 days later and get influenza.
When it's still, right,
Yeah.
right. So those of us who want to put the title doctor before our name should not, because the real doctor says that it's not possible to get the flu from the flu shot.
Right.
Now, there's discussion about the flu mist, which is more effective, flu shot versus flu mist. My kids, because they don't care for shots, and who really does, want to get the mist. And talk a little bit about the differences there.
Right. The last year, there was a study that came out that looked like the flu mist was more effective in children up to age 8. And so we were saying, okay, everybody in this age group needs to get flu mist instead of flu shot. There's a little bit more data that has come out since then that said, no, they're about the same. So my short answer is they're the same, other than one is in your nose and one is a shot.
Sure,
So, yeah.
sure. Regardless, though, the more people who are protected, the fewer opportunities there are in those close confined areas for the spread to happen. So how do the schools generally encourage, or when the questions come into school nurses about flu shots and that kind of thing, are we referring them the questions on to the clinics, or how do we handle those kinds of things?
Certainly there are some of the basic questions that the nurses are happy and capable of understanding or explaining and answering. And so, just some of the common information about influenza, how to prevent it, those kind of things. But if there are more real specific medical related, if it's specific to the student and maybe a condition that they have, certainly then we would refer them on to visit with their healthcare provider. So,
and when students are reporting when they're in school and they're reporting not feeling well, that type of thing, they go to the nurse's office. It's sort of a checklist kind of thing of what their symptoms are, how they're feeling, that kind of thing.
Right. The nurse is just really using her assessment of them and kind of putting together all the pieces. Certainly, when we start to see more students come in with signs of influenza, or when we know that the season's kind of at its peak, if we see somebody who's got even mild symptoms, we're going to be more apt to encourage them probably to go home, just knowing that we're at that peak season. But otherwise, yes, they're checking temperatures, just asking them about what exactly they're feeling like, looking for body aches, headache, those kind of things.
Those kind of symptoms. And there are things that we can use to reduce the symptoms, but really it's a virus that has to work itself out.
It is, in a way. There are medications that can decrease the length of time and the severity of it. It's not as dramatic as when you get an antibiotic for your ear infection and you feel better in a day or two. It's not quite that dramatic, but there are certainly medications that can be used with this one. We don't have one for the common cold yet, but for influenza we do. The problem with that is that you have to get on those medications really within the first 48 to 72 hours for it to be effective. If someone calls us or comes in and they test positive for influenza, but they've had symptoms for 5 days, the medication isn't going to help enough to be worth risking side effects, basically.
Sure. So catching it early
is very helpful.
Paying attention to those symptoms and not letting them go on for days and days and days. Any other advice that you can offer to parents who might be watching, grandparents who might be at home caring for their sick grandchild because mom and dad are at work? Any other prevention methods that we can talk about that would be?
Probably, and I think you've touched on the most important ones. The main things are washing your hands, covering a cough, and so that's really hard to teach to little ones, but especially our middle schoolers and high schoolers should be able to do that as well as us. But no, I think covering that cough is probably the biggest thing. And then when you cough, you probably need to wash your hands, and so having hand sanitizer or good hand washing techniques at home is just as important as in the school.
Okay, well, good advice there. Anything else from you, Molly?
Just paying attention, listening to your kids, knowing what's going on with their friends, and that's a good thing to kind of pay attention to what's going around, just so you're kind of staying in the loop of where we're at in the season, so to speak.
Sure.
And just always, I would encourage parents to contact their school nurse if they have questions about any of that, or kind of what's going on or what's going on in the school at that time.
Right, and so use your resources that you have.
Right,
absolutely.
And ask those questions that need to be asked. And I like the idea about finding out about your kids' friends also, because who do you think they're hanging out with?
Right.
And if so-and-so is sick, then how long is it going to take, if we had a sleepover, how long is it going to take for it to get to your family as well? So just real basic common sense. It's a good reminder for all of us as the flu season approaches, takes its hold, and even after the season has officially ended, we always need to stay on guard and remind ourselves of those good hygiene practices and prevention. So thanks for joining us today on Positive Parenting.
smallest moments can have the biggest impact on a child's life. Take time to be a dad today.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.